So the posterior compartment of the leg and the popliteal fossa. So we're talking about this compartment in details, about the muscles forming this compartment and the nerves, arteries, and we are going to talk about the fossa, the boundaries of the fossa, and the contents of this fossa. So let's go back again to the dermatome of the leg. As you see, the leg anterior here we had L4 and L5 and partially L3 participating here medially, and S1 a little bit lateral anterior. In the posterior aspects, S1 lateral and S2 medial, and as you see L3 the most medial. So this is the dermatomes of the leg. So again here, this is the compartment of the leg, the two bones of the leg, the tibia and the fibula. This is the crural fascia, anterior compartment, lateral, and here this is the posterior. The posterior is divided into two, superficial and deep group. The superficial flexor group and the deep flexor group. Here this is the interosseous membrane. So here interosseous membrane, and here intermuscular septum. This is anterior, this is the lateral, and the remaining are the posterior. The posterior as is divided into two, superficial and deep. The superficial containing this muscle, the gastrocnemius muscle and the soleus muscle, and the deep one containing flexor hallucis longus, tibialis posterior, and flexor digitorum longus. So these are the flexors group. So superficially here in the posterior leg we can see this vein running here, which is a small saphenous vein, which usually accompanies with the sural nerve, which is cutaneous nerve. So this is the small saphenous vein. It started here from the lateral aspect of the foot and runs behind or posterior to the lateral malleolus and drain into popliteal vein. Here we can see some superficial lymph vessels, and we can see the bulkiness of the calf muscle. Here these are the calf muscle, as we call it in a group, the calf muscle or the posterior leg muscle. The fascia covering here is the crural fascia, and here this is the tendon, Achilles tendon, or so the posterior compartment of the leg is made of superficial group, which include the lateral and medial head of the gastrocnemius muscle, the soleus muscle, and plantaris muscle. This plantaris sometimes could be absent. The deep group containing popliteus muscle, tibialis posterior muscle, flexor digitorum longus, and flexor hallucis longus. So this is the origin of the tibialis posterior, flexor digitorum, and the flexor hallucis longus, and this is the origin insertion of the popliteus. Here this is the popliteus muscle, as you can see, running in the posterior aspect of the knee joint, and this is the soleus muscle just behind or beneath the gastrocnemius muscle. So to see it, we should remove the gastrocnemius muscle. As I mentioned, if you can remember, when we talk about the tibia, we had mentioned that there is a soleal line which provides attachment for this soleal muscle. and here is the plantaris muscle. Yes. This is the plantaris. If present, it usually attached at the lateral supracondylar ridge. And this is the Achilles tendon or tendinocalcaneus. This is popliteus, soleus has been removed to see the deep groove. And here this is the popliteal artery, and the division of the artery into anterior, which supplies the anterior compartment of the leg, and the posterior tibial artery, which supply this posterior compartment. Here is fibular artery, and here these are the flexor muscles. You can flexor digitorum, flexor hallucis, and the tibialis posterior. At the level of the medial malleolus, we should remember this mnemonics: Tom, Dick, and very nervous Harry. Or you can remember easier: Tom, do a very nice homework. So if we take the first letter from each one, T for the tendon of the tibialis posterior, just find behind the median malleolus. D for, as you see here, if you follow, this is the tibialis posterior, and this is the tendon, come first, and then we had this D for the flexor digitorum tendon, A for the artery, posterior tibial artery, V for posterior tibial vein, N for this tibial nerve, and H for flexor hallucis longus. So remember, Tom, do a very nice homework, or Tom, Dick, and very nervous Harry. So here these are the muscles, superficial muscles of the posterior compartment of the leg. All of them are innervated by the tibial nerve, and all of them inserted into the calcaneal or the heel bone by the calcaneal tendon, tendinocalcaneus tendon or Achilles tendon. So this is the gastrocnemius. It has two heads, medial and lateral head, and the soleus, it's had originated from the soleal line, and the medial border of the tibia, and also it's originated from the head of the fibula and the posterior aspect of the fibula. Plantaris originated from the lateral supracondylar line and the oblique popliteal ligament. So both gastrocnemius and soleus, it's plantiflexion. So it do plantiflexion when the knee is extended. And also the gastrocnemius, it raises the heel during walking, flexing the leg at the knee joint. So added action to the gastrocnemius is flexion of the knee joint, because if you look at the origin, is the origin from the condyle of the femur above the knee joint, and this why. But the soleus muscle doesn't have an action on the knee because it's originated just below the knee. So the main action at the foot and ankle. Regarding the plantaris, it's weak flexing and assisting the gastrocnemius in plantar flexion. Very important to notice that this plantaris muscle, if present, it can be used as a tendon graft because it has a very long tendon, so it's sometimes used in plastic surgery to repair the cut tendons. The posterior compartment of the leg, the deep group. Here we have the popliteal muscle, the flexor hallucis longus, flexor digitorum longus, and the tibialis posterior. All of these muscles are the deep group of the leg, and they are innervated by the tibial nerve. The popliteus, its origin from the lateral surface of the lateral condyle and also from the meniscus inside the knee joint. And insertion is at the posterior surface of the tibia, superior to the soleal line. It weakly flexes the knee joint and unblock it by rotating on flexed femur. So unblocking of the knee is very important function. It's medially rotate tibia of unplanted limb. The flexor hallucis longus, it flexes the greater toe, and it's weak plantarflexion of the ankle. And very important action is supporting the medial longitudinal arch of the foot. The flexor digitorum longus, it flexes the lateral four toes, and it plantarflexes the ankle and support the longitudinal arch, both medial and lateral. The tibialis muscles had action is plantarflexion and inversion of the foot. So this is the muscles, and again, let's see them again. This is the flexor digitorum. This is the tibialis posterior, flexor hallucis longus, and this one cut it here. It is the soleus, and above here we have the gastrocnemius, two heads, and this is the plantaris muscle. So, and don't remember this, and please remember this mnemonics. It's help you to identify this structure in the cadaver. So let's move to the popliteal fossa. Popliteal fossa, it's a diamond-shaped depression posterior to the knee joint. It's superiormedially by the semitendinosus, semimembranosus muscle, and superior-laterally by biceps muscles. Is bounded inferior laterally by lateral head of gastrocnemius and plantaris, and inferior medially by the medial head of the gastrocnemius. It has a floor that's composed of femur, oblique popliteal ligament, and the popliteus muscle. The floor so is formed by the popliteal surface of the femur, the oblique popliteal ligament, and the popliteus muscle. Content including the common peroneal nerve and tibial nerve, small saphenous, popliteal vessels, artery and vein. So these are this here showing the diamond shaped popliteal fossa. As you see here, these boundaries, here we have the semitendinosus and the semimembranosus. Some textbook we can just find the semimembranosus here, and this is the biceps femoris, superior lateral, and here this is superior medial. Inferior medial and inferior lateral is made by the gastrocnemius head, medial and lateral. Sometimes if plantaris present, it will be here. The contents. The contents from deep to superficial. The artery is the most deep, including the popliteal artery and genicular branch, which are branches to the knee joint, genicular branch. So popliteal vein, the sciatic nerve, the tibial, common fibular portions. As you can see here, the most deep is the arteries, and here these are the genicular branch. This is the medial genicular superior, and this is the lateral superior genicular, and also here we have two inferior, lateral and medial inferior genicular branch. Superficially to the artery we have the vein, and the most superficial run the nerve, which is here the sciatic nerve. Here these are two portions of the sciatic nerve, the tibial portion and the common peroneal portion. As you see here, this is also the small saphenous vein, common and joining the popliteal vein, drain into popliteal vein. And here you can see some cutaneous nerve of the posterior side. So the nerves in the popliteal fossa, as you can see here, this the sciatic nerve, and this is the common popliteal nerve portion, and here is the tibial portion, and here this is a sural communicating branch from the common peroneal and the medial sural cutaneous. These together will form the sural nerve. And here this is nerve to the muscles, to the gastrocnemius and soleus muscle, and this one nerve to the medial head of the gastrocnemius. So thank you so much for your attention.